Hello, I am Dr. Kim. As we age, our foreheads, eyebrows, and eyelids droop sequentially, which can obstruct our vision. I once said that the solution for drooping eyes caused by aging is to undergo subbrow blepharoplasty and buried double eyelid plasty. If you haven't watched the previous video, I suggest viewing it first. Today, I'd like to explain in more detail, with several examples, why subbrow blepharoplasty and buried double eyelid plasty are the ideal solutions for droopy eyes caused by aging. As we age, our skin sags, creating a triangular eye shape similar to the one in the picture. If you analyze the reasons for eye drooping, you'll find that in most cases, approximately 60 to 70% of the causes stem from forehead or eyebrow drooping. In contrast, about 30 to 40% of the causes originate from the eyelid drooping. When it comes to sagging eyes caused by age, they can be divided into two types: eyebrow sagging and eyelid sagging. It's a combination of these causes, so it's best to address each of them separately during the surgery. When I operate on eyes that have drooped due to age, I first lift the tissue beneath the drooping eyebrows with a subbrow lift to elevate the skin and muscles, thereby lightening the eyes. Then, I suggest reducing the drooping eyelids by folding and shortening them with buried double eyelid plasty. If your pants are too long, you will need to cut them, as illustrated in the picture on the right. However, if they are not too long, you can fold them. The same applies to the eyelids. You'll remove a considerable amount of loose skin and lift it beneath the brow, as shown here. Since I've had this subbrow blepharoplasty, the amount of sagging skin on the eyelid is eliminated in the first place. Then, I will fold the eyelid using a buried method without incision to reduce lid laxity. When you fold the eyelids this way, it feels as though you're folding your pants, creating a similar effect to that of a long skirt. If you undergo a buried double eyelid plasty, you can reduce excess skin, allowing for clearer visibility of the eyes, while also concealing sagging skin. Cosmetically, it's significantly improved because you're transitioning from a dull, unflattering eyelid to a more vibrant, defined double eyelid. The reason I'm performing this without an incision is to minimize the scope of the surgery. However, the outcome is very natural when done this way, so I proceed with as little incision on this eyelid as possible. However, during the consultation, some patients asked me, "Can't you raise the skin of the eyelid without using buried eyelid plasty for drooping eyes and just do a subbrow blepharoplasty?" If you look at this picture, you can see that even though I've performed as much subbrow blepharoplasty as I could to lift the dot here under the eye to the top, there's still some eyelid laxity here. As I mentioned earlier, there are two causes for eye drooping, brow drooping, and eyelid drooping, meaning that no single surgery can completely correct them. As I mentioned earlier, there are two causes for eye drooping, brow drooping, and eyelid drooping, meaning that no single surgery can completely correct them. However, if you have transparent, symmetrical double-fold eyelids on both the left and right sides, as shown in this picture, you can achieve good results with a simple subbrow blepharoplasty. Therefore, you don't need a double eyelid plasty. However, if you don't have double fold eyelids, or if your double folds are too small, or if your double fold eyelids are asymmetrical or not well defined, as shown in this picture, consider buried double eyelid plasty. In this case, it's always better to perform a buried double eyelid plasty after subbrow blepharoplasty, as it can help improve the asymmetry between the left and right sides and achieve the desired eyelid size. The scars from the subbrow blepharoplasty are nearly invisible. Additionally, since it is a buried double eyelid plasty performed without an incision, there is no visible scar on the eyes, and they appear very natural. In most cases, I recommend a sub-brow blepharoplasty and a buried double eyelid plasty. However, if you have a significant amount of excess eyelid skin that the surgeon cannot fold over, I would suggest an incisional eyelid lift to remove that skin. However, even in this case, if you perform a sub-brow blepharoplasty first and then an incisional blepharoplasty, you can minimize the removal of the thin eyelid, helping you avoid that awkward look. Even if eyelid drooping is not severe, it can be challenging to correct using buried double eyelid plasty if the eye does not open properly due to abnormalities in the muscle that controls eye opening. In such cases, ptosis correction surgery and blepharoplasty surgery should be performed. I explained why ptosis occurs in older patients and how to correct it in a previous video, so I hope you can take a look at it. Similarly, to achieve a more natural eye shape, you should first lift the skin with sub-brow blepharoplasty to smooth it out, and then undergo ptosis correction surgery. This will result in a more natural eyelid shape. Even if the extent of the surgery is slightly increased, the outcome will be improved if you follow this approach. Now that you've heard the explanation of how to address droopy eyes caused by aging, it makes sense. You don't need to worry too much about droopy eyes, as the right surgery can help you achieve a natural-looking result without making you look awkward or unattractive. However, the outcomes of the same sub-brow lift surgery can differ significantly based on who performs it and the technique used, so be sure to consult with an experienced plastic surgeon. If you have any questions after watching the video, feel free to leave them in the comments below. Thank you.